Hey there, we're going to be performing mouth care for a comatose patient. It's a little bit different from the mouth care for an alert patient. So here we go. Knock, knock, knock. Hey Terry, I'm Misty. I'm going to be performing mouth care today. So I'm going to clean my hands here. I'm going to check the brakes on your bed. Since we are going to be turning you to your side. I'm going to pull your privacy curtain. And I'm going to go ahead and raise your bed up, Terry, so I can reach you. You need to be sure you raise your bed to a nice, comfortable working height for you because your patient is comatose, so you have to turn them so you can reach them and so you can clean their mouth without any risk of aspiration. So here's your collar. I'll place that right there. All right, Terry. So I have a pillow here, so we can turn you onto your side. I'm going to place it right here. At this point, if you need help, your nurse examiner can help you turn the patient to the side. I believe Terry's going to turn here pretty well. All right. So I'm going to use this pillow to help prop Terry up onto his side. Just making sure that he's not laying on his arm. He's pretty comfortable. All right, so Terry's on his side. And what I have here are all the supplies that I'm going to need. I have an emesis basin. I have my mouth cleanser. Oftentimes you don't need that. You're going to use probably 2 sets to clean. I have a cup of water and an empty cup. And then sometimes the little mouth care kits are made like this. They're already set up and you don't even have to get 2 sets or any sort of cleanser. It's already in the kit. But right now we're just going to use the individual 2 sets. One little point, when you guys are getting your 2 sets, you want to always check to be sure that the sponges are securely attached. So they usually come individually packaged like this. So as you open them, a good way to check is to pop it open. And as you're pulling it out, you're pulling on the sponge. And that will tell you whether or not it's going to detach in the patient's mouth, which would be a hazard. So now that my 2 set is open, I'm going to place all 3 into the water. I'm going to go ahead and put on some gloves. We get a towel. Place it right under my patient's mouth. Have an emesis basin right there at the ready. And now I'm ready to clean my patient's mouth. So I have a wet truvette. You need to squeeze out the excess water. And you're going to clean all of the surfaces in the mouth. You need to clean the flat chewing surfaces, the inner surfaces of all the teeth, all the outer surfaces of all the teeth. As you are finishing with your sponges, you should be throwing them out. I'm going to get another sponge. I'm going to use this sponge to clean Terry's tongue and the roof of his mouth. I'm going to throw that one out. And then I have one more sponge. I'm going to use that to clean the gums, along the gum line and the cheeks. So I've thrown all 3 sponges out. Dry his mouth. I'm going to go ahead and remove the towel. But because my patient is comatose, I'm not going to leave my client alone. I am going to make sure my client is safe before I clean up. I'm going to go ahead and remove the pillow that I used to prop him up. I'm going to get the call bell and lower his bed. Just fixing your gown here, Terry. That looks like a safe height. Make sure my patient has his call bell in reach. All right, now I can clean up my mess. So I'm going to take my towel and place it in the laundry. I'm going to empty out my water, throw away white cups, and the disposable pipettes. Take any extra supplies out of the room. Rinse his amethyst basin and dry it. I'm going to place his toothbrush and his amethyst basin in his used supply area. And then I'm going to remove my gloves and hand hygiene. And you are done with your skill. Be sure you